The Trump administration has struck a deal to give immigration officials access to Medicaid enrollees' personal data. It's expected ICE will use that information to try to track down immigrants who may not be living legally here in the U.S. Fox 4's Casey Stegall has more on that agreement.
The Trump administration has reached an agreement allowing immigration authorities access to the personal records of Medicaid participants. ICE is expected to use this data to locate immigrants who may be residing unlawfully in the United States. Fox 4's Casey Stegall has the details on this deal. Notice how the anchor carefully frames the situation with the phrase, "may not be living legally." That's a mild way of putting it. The truth is, these aren't simply visitors. They are individuals violating federal law.
Information to try to track down immigrants who may not be living legally here in the U.S. Fox 4's Casey Stegall has more on that agreement.
Yeah, Heather, good evening. A DHS spokesperson, in fact, tells Fox 4 that the new initiative will help ensure that undocumented migrants are not
while using benefits funded by citizens who built this country. Labels like undocumented are simply disguises for the reality. Millions bypass the legal system every lawful immigrant is required to follow. This isn't about kindness. It's about refusing to accurately identify the problem. As Casey Stegall reports, ICE will gain access to information to track immigrants suspected of living here unlawfully. According to a DHS spokesperson, this effort is meant to ensure those without legal status aren't receiving Medicaid coverage. Let's be direct.
Advocates argue that this unprecedented move will hurt more than it will help.
These individuals aren't just in need. They are here in defiance of our laws. Every benefit given is another resource taken from citizens who follow the rules. Pretending otherwise ignores the core principle of sovereignty. The administration is finally using existing tools to enforce immigration law, something voters demanded long ago. Providing ICE with this data isn't excessive, it's long overdue. If this exposes fraud and saves taxpayer dollars, the majority of Americans support it. Critics may call it harmful, but the real harm is citizens being forced to wait behind those who shouldn't even be here. Under this agreement between DHS and the Centers for Medicare and Medicaid Services, ICE will have access to personal records from nearly 79 million Medicaid recipients. The Associated Press reports that this information will be used to identify and track people believed to be in the country illegally. This is what true enforcement looks like. Finally taking action to remove individuals who broke the law.
Doesn't care whether or not we have a current immigration status or what our income is.
Americans have been waiting for this for years. Critics argue healthcare is a right for everyone. But healthcare isn't a global guarantee. If you illegally enter another nation, would you expect to receive taxpayer-funded services? Of course not. Yet here, some insist it's only fair. The truth is, many activists oppose borders altogether. They talk about compassion, but the cost falls on working families, veterans, and citizens who are skipped over in favor of those who came illegally. Charity begins at home. If someone wants to help overseas communities, they're free to go abroad, but forcing U.S. taxpayers to fund aid for those who broke the law is not charity. It's coercion. This isn't compassion, it's political theater. Advocates of open borders rarely give up anything themselves. Instead, they demand hardworking Americans cover the cost. Meanwhile, our own veterans sleep on sidewalks, families can't afford health care, and schools crumble. America cannot serve as the world's emergency room. Putting citizens first isn't selfish. It's responsible leadership.
This is egregious overstepping of access to individuals' information. Health programs are sacred.
Public health advocates claim this move is an invasion of privacy, but taxpayer programs are only sacred when they serve the people who paid into them. Federal law doesn't fund benefits for those in the U.S. illegally. The phrase undocumented citizen is meaningless. Citizenship requires lawful entry and contribution. Anything else is unlawful, plain and simple. Critics say this will create a chilling effect in migrant communities, discouraging them from seeking hospital care. But if fewer illegal immigrants use emergency rooms due to fear of deportation, that means enforcement is working. Fear is accountability. And accountability is exactly what's been missing. That a Congressional Budget Office report shows that from 2020 to 2023, taxpayers spent over $16.2 billion on emergency Medicaid for illegal immigrants. Just health care, not housing or legal services. Illegal immigration isn't free.
Will avoid emergency rooms in hospitals when they possibly can because of policies like this.
It's draining billions while politicians pretend otherwise. NBC4's Amber Frias reports from South Los Angeles on what this means for families. What it really means is that law-abiding Americans who've sat for hours in ERs may finally get the care they've been waiting for. According to the Associated Press, ICE will have access to home addresses, birth dates, social security numbers, and even ethnicity information of Medicaid recipients. This is an abuse of power. It's common sense. If you're receiving taxpayer benefits, eligibility should be verified.
Major development in the Trump administration's immigration crackdown. ICE is being granted access to personal information from Medicaid recipients.
NBC4's Amber Frias joins us now from South LA with what this could mean for millions of families. Amber.
For lawful citizens, nothing changes. But those using false documents may finally face consequences. DHS describes this as an initiative to ensure Medicaid benefits are reserved for legal Americans. That's fairness.
Carolyn, Kathy, according to the Associated Press, federal immigration officials would have access to home addresses, people's ethnicity, their birthdays, and even social security numbers.
If you work, pay taxes, and follow the law, you deserve the benefits. If not, don't expect rewards. Healthcare providers like Dr. Edgar Chavez argue this will harm communities. But harm to whom?
For all those enrolled in Medicaid.
In its continued effort to arrest 3,000 undocumented immigrants daily, the Trump administration will now start sharing the personal information of nearly 79 million Medicaid enrollees with ICE.
To people who never had a legal right to benefits in the first place, programs like Medicaid, food stamps, and housing were created to support American citizens. Now those resources are being drained by individuals who entered unlawfully. Every dollar given away is a dollar denied to citizens in need. Some states, like California, allow non-citizens to enroll, but federal law still requires emergency rooms to treat anyone in crisis. Yet ERs shouldn't be wide open doors for the world. Cross a border illegally. And healthcare should come from your own nation, not from U.S. taxpayers.